Hi, my name's Courtney, and I'm a retail pharmacist in a metropolitan area. And today I'd like to talk about the Ozempic drug shortage. We've probably all heard about Ozempic right now, considering that drug marketing is normal and legal in the United States. And because of this, along with social media trends, Ozempic has gone viral. Ozempic was originally approved for diabetes back in 2017 and quickly became noteworthy because of its side effect of weight loss. Due to this side effect, the drug company Novo Nordisk actually started doing clinical trials for Wegovy, which is the same active ingredient as is in Ozempic, semaglutide, and Wegovy was approved for weight loss. Both Wegovy and Ozempic are once weekly injectables that can be used at home and are injected into subcutaneous tissue. In fact, Wegovy and Ozempic are not even Novo Nordisk's only semaglutide product. There's also Rybelsus, which is a once daily oral pill. So different formulation, different drug profile. But all three drugs, Ozempic, Wegovy, and Rybelsus, do require a dosing schedule. And this is to reduce or mitigate adverse effects, primarily stomach upset, nausea, vomiting, diarrhea, etc. Ozempic is initiated at 0.25 milligrams subcutaneously once weekly for 4 weeks, then increased to 0.5 milligrams once weekly. 0.5 milligrams could theoretically be a treatment dose. However, the dosing did originally go up to just 1 milligram once weekly if needed. Recently, actually, and starting in 2023, a 2 milligram dose once weekly pen will be in distribution for Ozempic. So now starting dose is 0.25 milligrams, which is considered just a starting dose. It is not a treatment dose. The dose is intended to be increased to at least 0.5 milligrams and up to 2 milligrams once weekly. So I have a demo pen here. This is for the lowest dose pen, so either 0.25 milligrams or 0.5 milligrams. And right here you have a dosing window. This is the knob which you'll use to dial your dose. So 0.25 milligrams or 0.5 milligrams. And this dose contains either 6 doses if you're doing the 0.25 milligrams for 4 weeks, plus the 0.5 milligrams for 2 weeks, so 42 days, or it is 1 month supply, 28 days, if you do 1 dose of 0.5 milligrams once weekly for 4 weeks. The Wegovy pens are different. There's no dialing of the dose. The dose is preset. You just inject the whole pen and then you throw the pen away, as opposed to these Ozempic pens. They are okay to be reused until all the medication is used within them. And shortly after Wegovy becomes approved, there's a shortage. The drug company Novo Nordisk claims that this is due to increased demand that can't be met by production. So there are 5 different strengths, 5 different NDCs or products of Wegovy: the 0.25, 0.5, 1, 1.7, and 2.4 milligrams. So that's a lot. That's a lot for them to produce, to have production going on. And when the Wegovy shortage initiated, what they did was they stopped producing the first 3 strengths. They wanted people who were already on the drug to continue the drug. They wanted to focus on meeting the demands of that population, and they didn't want anyone to start it. So they didn't have any of the 0.25, 0.5, or 1 milligram strength available for months. We were still getting prescriptions. Patients were still calling and asking, and I had no idea when they would become available. Wegovy was in high demand, but not available for anyone new to start it. So they didn't get to. We just put it on hold. You know, if there was a prior auth required, we would submit for a prior auth. And basically, we were just waiting for Novo Nordisk to increase production. So Wegovy is backordered. Then people realize, oh, it's semaglutide, same dosing schedule, different product, but it can be essentially the same dose can be achieved using the Ozempic pen. So the 0.25, the 0.5, the 1 milligram, this can all be achieved with Ozempic. We don't need Wegovy. So people start getting prescriptions for Ozempic for weight loss when Ozempic is technically approved for diabetes. So also because Ozempic is older, has more data, has become a part of the diabetes guidelines, it is on insurance formularies. So insurance plans are covering it without the manufacturer's coupon that Wegovy users are using. So increased demand for Ozempic. And it goes viral. People are losing weight, people are going to TikTok and posting their videos, and celebrities are using it, and it's all over the internet. Every day when our distributor order would arrive with all of our drugs that we ordered the previous day, we would look for the refrigerated tote. It's blue, very obvious. And we knew immediately if we weren't getting Ozempic if there was no blue tote. So maybe 1 or 2 boxes of Ozempic would come in per week when we've had patients on this medication for years. Now people are getting new prescriptions for it that we just can't provide. People are having their prescriptions transferred, then they want it transferred back because the pharmacy that they had transferred to didn't have it in stock. Back orders. So Novo Nordisk did come out and say that the increased demand was not the only reason for the Ozempic shortage. What they officially said in their 2022 annual report was that COVID-19 and the war in Ukraine have adversely impacted global supply chains, while higher than expected demand, including for our GLP-1 products, and temporary capacity limitations at some manufacturing sites have led to periodic supply chain constraints for some of our products, including our flagship GLP-1 therapies, Ozempic and Wegovy, which we expect to continue into 2023. We are just starting March of 2023, and Wegovy and Ozempic are still on back order, but they are coming in slowly. So when I try to order Ozempic from my distributor, I get a message that says, supplier allocation next release early March in 2023, supplier experiencing unanticipated increase in demand, full recovery TBD. The same is essentially true for Wegovy. So according to Novo Nordisk, both the Ozempic and Wegovy pens should be no longer backordered soon. So I was looking for more information about how much the demand for Ozempic has increased, and on Novo Nordisk's website, they have their 2022 annual report in which they share their growth by diabetes area. And looking at this graph, looking at the dark blue, you can definitely see that these GLP-1s, which Ozempic and Wegovy both are, but technically this is not talking about Wegovy because this is diabetes. Wegovy for weight loss. Ozempic for diabetes. So regarding the growth of Ozempic, Novo Nordisk says that Ozempic sales increased by 77% in Danish kroner, which is just a form of the Denmark currency, and by 61% at CER, which is closer economic relations, which is some sort of trade agreement between Australia and New Zealand. I don't think that matters, but regardless, we see that Ozempic sales grew enormously over 1 year. It says sales, so the sales went to 59,750 million Danish kroner I did some math. Right now, the exchange rate for 1 Danish kroner is 0.14 US dollars, which came out to $8,567 million. That's how much they sold worth of Ozempic in US dollars. So $8,567 million US dollars in sales of Ozempic in 2022. Can you imagine what this growth would have looked like if there weren't production issues? They had huge potential for growth that they obviously couldn't meet, but I mean, this drug is going to do well in the future for good reason, both Ozempic and Wegovy. Novo Nordisk also has a new Ozempic product coming to the market. It's the 3 ml pen, similar to other diabetes pens, so it seems like they do have a plan to increase production if they're coming out with new products of the same drugs. So overall, it seems like they are staying true to tackling the production issues and coming up with ways to meet the increased demand. So a couple of final thoughts on the Ozempic drug shortage. Unlike other medications that are not covered by insurance that require PA, patients want Ozempic. They want to lose weight and they are willing to pay for it. A lot of times I'll tell someone the price of the drug and they'll just say no. And that's completely fair, but people put a higher value on losing weight. So I have seen people pay $900 and something, $920 for a 1 month supply of Ozempic. People want this drug. They want to use it. They want to see how it can benefit them. Another quick thought is that in Australia with the drug shortage, they actually recommended not using Ozempic off-label for weight loss. So they only want it to be used for its indicated purpose, which is type 2 diabetes. And we'll see as the drug shortage begins to die off and the drug becomes available. We'll see how that prescribing changes. I think we'll definitely see a big increase in prescribing overall as doctors and patients become aware that it's available again, and as we're able to distribute it normally and have patients be on time with their medication. So I think Novo Nordisk will do even better in 2023 than they've done in 2022. And these drugs that have these benefits that we haven't seen in many drugs in a long time, especially new drugs, it's really exciting. So we'll see. We're learning a lot. Cheers.